doctors and the nurses were telling you that everything was fine during labor, and then all of a sudden it wasn't fine. And now your baby has been diagnosed with a hypoxic ischemic encephalopathy or an HIE brain injury, and now you're left trying to understand how did things go from supposedly normal to where you are today. And I recently spoke with a family offline that was going through this exact same thing. Everything looked like it was going well. Pregnancy, there were no issues. Got to the hospital, there were no problems until the end of everything, and now they have a baby with an HIE brain injury. And I want to talk about that. I talk with a lot of families across the country who have to deal with this, and this is more common than I think people understand. And many of the calls that we do get, a lot of times these families and these mothers, they have uneventful pregnancies. There were no major complications that were going on during pregnancy. And like I said, initially getting into labor, there were no issues. Some of these mothers are considered what's called advanced maternal age, but many of them are not advanced maternal age. And a pregnancy and even a labor can appear normal until, like I said, it's just not normal anymore. And that is, I think, where a lot of confusion can happen for families, because when you are being told during labor that everything is looking fine, everything is going on schedule, you begin to rely on that. You begin to trust that, but you have to understand that labor is not static. It's not static. Labor can change over time. And while some situations they truly will change suddenly, it'll be a sudden change. Other situations can develop gradually and over time. And that's going to lead to a really important question. When you were being told that everything was fine by the doctors and the nurses, what was actually happening at that time? In some of these cases, fine will mean that there were changes that have not yet been recognized as a problem. So for example, you could have fetal heart rate tracings that may begin to shift as time goes on. You may see patterns that are not clearly normal yet, but they're not going to be classified as an emergency. And that can be sometimes when we see these category 2 tracings, which will require ongoing evaluation. Because a category 2 strip, it doesn't necessarily mean normal, so to speak. It means like it's an intermediate. It's in between 1 and 3. And over time, those patterns can begin to evolve. So you may see over time, you may start to be able to see recurrent deceleration. You may be able to see changes in the baby's variability. You may be able to see signs that the baby is under stress as time is going on. And if those patterns continue for a considerable amount of time, that can become significant in the analysis of everything. And it's also important that you have to understand that the medical team is not looking at these changes or looking at how labor is progressing in isolation. They're not doing that. They are seeing things and they're seeing the tracings as they develop over time. They have the benefit of watching the pattern evolve minute by minute. That developing history, it does become part of the clinical picture. So the question is not just like what did things look like at this one moment. That's not the question. It is how these patterns were trending and how they were interpreted as things begin to change. So when we look at these cases, we're not just looking at what happened at the very end. We're not just looking at the end result. We're looking at the entire timeline of everything. When did things begin to change, if they did begin to change? What did the tracing show? How did the medical team respond to what they were given notice of during labor? Was there an escalation that was needed? And if it was needed, was that done? Were there timely interventions that took place? Because sometimes what can feel like a sudden emergency, it's not actually a sudden emergency when you go back and you review the record. Sometimes there was a window of the baby showing signs that the baby was in trouble, and that can be difficult to reconcile, especially when you are being reassured in the moment that everything was okay. Not every situation is preventable. Sometimes you will have events that will happen so quickly, and even with appropriate care, you can still get unfavorable outcomes. But that doesn't remove the importance of carefully reviewing what was happening during labor. So because, hearing everything was fine and later facing an HIE diagnosis, that's going to raise real questions for mothers and for families. And those questions deserve a review to be able to look at everything so these families can get answers. Again, I'm Marcus Boston. If you have any other questions about your baby's HIE brain injury at birth or a subsequent CP or cerebral palsy diagnosis from a medical legal standpoint, don't hesitate to reach out and contact me. You can find out more information about me in my profile. My information is there. If you're watching this video on certain apps, you can send me a DM and we can chat a little bit about your baby story, or you could just wait and watch the picture that follows the end of this video. All right, that's going to be it for today's quick educational video. Have a great weekend, everybody.